Scientists at the National Centers for Disease Control in Atlanta today released the results of a study which shows that the lifestyle of some male homosexuals has triggered an epidemic.
It's mysterious, it's deadly, and it's baffling medical science. Acquired immune deficiency syndrome. Once thought to affect only promiscuous homosexual males, AIDS is now spreading in epidemic proportions to other segments of the population.
In early June of 1981, over 40 years ago, gay men in their 20s and 30s began checking into emergency rooms in major cities around the country with a very rare lung infection. Unknown at the time, but the world was about to change forever. It wasn't until 1984, nearly 4 years later, that we discovered the cause of AIDS was a stealthy virus that we have come to know as the human immunodeficiency virus, or better known as HIV. Almost 4 decades later, HIV has led to a global pandemic, a series of regional epidemics, and tragically has taken the lives of more than 37 million people worldwide. A fact that has led to a 40-year struggle for a cure. Hi, my name is William Wheaton, and I work here at Positive Impact Health Centers. I have been with this agency for 5 years. Every single day, I work to connect the community with preventative services, specifically people under the age of 30 years old with services like PrEP, HIV testing, and yes, HIV treatment, which is an extremely important part of HIV prevention. For World AIDS Day 2021, my colleagues and I put together this project to catalog the amazing and transformative work that we get to take part in every single day. The theme of World AIDS Day this year is ending the epidemic. And I wanted to talk with people who are doing just that, ending the epidemic. I want to see how they do it, why they do it, and what motivates their work every single day. Positive Impact Health Centers recently celebrated 30 years this October. The agency that we see today was formed in 2015 when Aid Gwinnett, founded in 1991, and Positive Impact, founded in 1993, merged together. And now this agency serves over 9,000 clients every single year. I am joining you from Decatur, Georgia, where Positive Impact Health Centers operates a pretty busy community health center, fully equipped with pharmacy services, an addiction treatment program, HIV treatment and testing centers, as well as a soon-to-come dental facility. Over the course of this film, I will speak with people who have seen the agency from its humble beginnings and those who have joined relatively recently. But before we do that, we must go back to 1981. I sat down with Larry Lehman and Joey Helton, Positive Impact Health Center's CEO and COO. You know, I view Larry as like a chronicler of Positive Impact Health Center's history because he has seen the agency when it was just a group of friends joining together to say, hey, something needs to change, to now leading and steering this organization. And the same with Joey. Joey joined the agency after the merger, but has seen and led the agency through some transformative and amazing growth. So I wanted to talk with them to not only figure out where we came from, but what will it take for the next 30 years of this agency? Take a look at what they have to say. Good morning, guys. How are you?
Good morning.
All right. So the first question that I want to ask you, I want you to introduce yourselves. Tell me about your journey at Positive Impact Health Centers, how long you've been here. And then I want you to tell me about the moment when HIV became a major factor in your life, whether it's personal, friends, family, relatives. When was it like, okay, this is something that I need to focus on. This is something that I am determined to solve.
My name is Joey Helton. I'm the COO here at Positive Impact Health Centers. I've worked with the agency for 5 years, but I've known the agency more than a decade. As a small child in a rural town in East Tennessee, I remember growing up and thinking that I was the only person in the world that felt the way that I felt, and this was in regards to my sexuality. I didn't know anyone that was gay. I don't think that I had ever met anyone that was openly gay. It wasn't until college that I met other people like me. And I remember one person in particular that I met when I first went to college. His name was Greg. And Greg was a little bit older than me. Greg introduced me to several people in the community. Through those relationships, I built a network of friends, a support system. I was able to self-identify with who I am and to become stronger in regards to who I am. And unfortunately, a few years later, Greg passed away. He was living with HIV and had been diagnosed with AIDS. And that really brought it full circle to me.
So Larry, it's been 40 years since the first patients walked into hospitals in LA and San Francisco and New York. And we often hear about those cities being the epicenters of the AIDS epidemic and the HIV epidemic. What was it like in Atlanta? You know, for you personally, you can attest to those early days here in the city, because we don't hear too much about Atlanta's journey with HIV. And how did that wrap into how organizations like A. Gwinnett and Positive Impact was formed, and your personal story as well?
I moved to Atlanta in 1982, and at that time it was a party city. It had been for a long time. Most of Midtown was lots of gay bars. You could carry a cocktail on the street, and everyone just had an incredible time all the time. And then in the early 80s, we started hearing this news about GRID and different things, long before it was called HIV or AIDS, and seeing it mostly in the West Coast, and then started seeing New York in different numbers. If you go back and look at the early history of AIDS Atlanta, it was a group of folks, friends of Graham Bruton, that raised money and sent it to Gay Men's Health Crisis in New York. And one of the most incredible things was they sent it back. And they said, this will be in Atlanta as well. You need to start something right away. You need to get ahead of this. And that's how the early beginnings of A. Gwinnett. I started volunteering for them around 85, 86, and had an incredible opportunity to meet an enormous number of people, and was so impressed with what this very small group of staff and board members thought they could do in a community with basically no funding. There were no federal dollars, no state money at that time, and you had people literally wanting to shut you down. The state legislature did not want anyone buying condoms. They didn't want the Department of Public Health giving out condoms. You know, I think we have so many incredible things now, but in the early years we didn't have any of that. We fought for every inch of that. A. Gwinnett was started in '91, mostly by adults who their children, adult children actually, were coming home to die, was what was happening. Peggy Terrell, Marty Crossman, Dr. Raisy, his wife Beth, realized that they could do much more than just providing emotional support, that they could actually do basic and palliative care. And I can stay with your son while you go shopping, you come stay with my son when I go places I have to go, I'll help you take him to the doctor. And it literally just a hands-on network of support that grew into an agency, like so many around the country, just that very early beginning. I moved here, and there was about 30 of us that ran around in Ohio that ended up living here. And part went to Houston, part came to Atlanta. And the majority all ended up in Atlanta 2 years later. Of that entire group, there's 3 of us alive today, and that's it. And there's nothing all of them did that we didn't do as well. So how we got through that is an absolute miracle, I think, for the 3 of us as well. I think in the early part of this, before there was a test, the incredible amount of fear in gay men was unbelievable. If you look around right now, most men my age are not here. Most men that were HIV at that time are gone. And I think one of the best things that happened in this city was a group of therapists under Chris Aller's direction realized there was an incredible need for mental health. And Positive Impact was started in '93, basically to respond to the mental health needs of folks with HIV and the incredible grief and stress. Where most people early on, cancer, heart disease, would turn to religion, in HIV they didn't.
In the vein of working with your colleagues and especially serving the patients and our clients in the community that we serve, how has that affected your personal journey in your time here at Positive Impact? How have you noticed, like, wow, this matters. This work, I am where I'm supposed to be, and this work is meaningful to me. So how has this work and working with these folks in this community affected you personally?
Well, I am grateful every day to do what I do. To see folks literally come in the door sometimes so broken, and seeing them on their worst day, and then following them sometimes a few weeks, a few months, sometimes even years, right? And getting to see the progress behind that, and getting to see people literally go from being such a broken person that you see a sense of esteem and hope distilled in that person. So it's challenging, but also very sweet and rewarding to do the work that I do.
Absolutely. Thank you. Larry, what is your proudest moment? This may be a very big question because I'm sure you have had so many rewarding moments. As someone who does HIV testing, you know, there are constant moments where, like you said, you meet someone on, to them, maybe their worst day, but the reason why we can continue to do what we're doing is because we know that there's hope and there's progress in that moment. So with that in mind, looking back over these years, what is your proudest moment?
There's been so many, and I think it's been incredibly rewarding. I have the opportunity every morning to get up and do a job I love and come and be around incredibly creative and inspirational people. I think one of the things that to me still, when I'm in the different clinic buildings, it is the incredible relationships that people have built with the community on staff. They're frontline, one-on-one with individuals. It creates a bond. It makes people feel comfortable. And I think what people often forget, our community and sometimes our providers forget, what makes the prevention thing so effective in PrEP is all the wraparound services. It's not handing somebody a bottle of pills. It's all the support that they have, and emotional support and follow-up and care that they have that makes that work. And I think what incredible difference it makes in this agency is an incredible relationship the staff builds with the community and the clients they work with. It is absolutely phenomenal to see clients hug staff when they leave. But I think it's that incredible relationship and watching that happening over and over, and it happens in our mental health programs. If you talk to the folks that have gone through our impact and substance abuse program, that is so critical for that service to work and that bond to take place. I think for someone coming in getting tested today, that fear, is anyone going to love me? Am I going to live tomorrow? Who can I tell? Who can I tell or not tell? It's the same as it was in 1987 when we first got the test as it is today. I have had the ability to have my office typically in the front of most of the clinics, be able to see the parking lot, which was critical for me to do, or I felt it was. I can't tell you the number of times I've seen someone leave with a reactive result, break down in the parking lot. People fall down in the parking lot. People make it to their car and not leave for hours. Many, many times, notifying prevention or counselors, you have to go out. There's someone outside you need to follow up with right away. It's just absolutely critical that we have that one-on-one wraparound piece forever. I think there's a lot of folks, Capitol Hill, different people, legislators and things. It's just give them their pills and that's all you need to do. You don't need all these support services anymore. Let's take that funding away and you'll have more dollars for care if we strip all that out. The reality is you don't have the same level of care, you don't have the consistency, and you don't have people coming back, and infection rates grow, and you have a bigger burden of care at this point. I think it's just absolutely so critical that we continue to encourage that one-on-one support, and we encourage staff to take the time to do that and network and make that happen.
Mm-hmm. Years ago, Larry and I have known each other for quite some time. Larry was sharing with me a vision that our board of directors and himself had for the agency that would fit within the community, help the community, and so forth. Part of that was a medical home model so that when you came here, you left with everything that you needed. From an operational perspective, I think one of my proudest moments was the day that we actually saw that happen. So it went from ideation to implementation. It was Friday afternoon, 4 o'clock. We had a client that came in terrified to get tested, and this was a Latino client. One of our testers came into the lobby, took him back. He went from testing to linkage. His test was reactive. He went from testing to linkage. He went from rapid entry into clinic. He saw a case manager while he was on site. He started a housing application. All of the things that were needed, to help him on his journey, were given to him that day. And he walked out the door within 90 minutes, medication in hand. And to me, holistically, from an operational standpoint, that was probably one of my proudest moments, to see something that Larry and I talked about years ago actually being implemented and happening. And you could tell that he went from coming in a broken state to leaving with hope and leaving with there's actually something, someone, someplace now that I can go to get the care that I need.
So my final question to you both is the mission of Positive Impact. What does it mean to provide a life worth loving?
What we wanted is something that was live and active and real. And every individual is completely different. And everyone comes to us with a different story, a different avenue. So their life, what they value, worth loving. Some people come to us with substance abuse issues, different health issues. For them, that is, they need the help in this area first and then the other pieces. For our transgender clients, typically hormone therapies is more important first, and then move on to other pieces here. So I think to make sure that their life is of value and respectful, and we meet them at that level, and we work with them to achieve those goals. And a lot of times, I think for all of us, we don't always know what we think would make our life better or worth living. But I think it's absolutely critical we have the services in place so we can value their needs and generate that life worth living for them.
Joey?
I think Larry's spot on. To me, it's how do you prioritize what your goals are? For some folks, it may be a place to sleep tonight. For other folks, it may be a journey to get a college degree. For some folks, it could be maybe finding that friendship or that bond that is more accepting than the family environment that you're coming from. Whatever that is what we want to help you accomplish at Positive Impact Health Centers. But I think however you would define your life to be worth living and loving is how we would help to prioritize the care and the services that we would give to you.
Absolutely. Wow. Thank you, guys. Any final thoughts?
AIDS is not over by any means. We're not on the front page anymore, but we're just as critical as we've always been to be out there and to provide services. And I think I would leave with one thing always: we have to have Medicaid in the state. We have to have Medicaid expansion. I would strongly encourage folks to contact the governor's office and anyone they can contact. We've got to make this change, and soon.
Absolutely. Well, thank you guys so much for your time. Thank you for your responses. And I appreciate it so much. And here's to another 30 years.
Thank you.
All right. Thank
Cheers.
you. There's something really powerful about hearing the way Positive Impact Health Centers has grown from such a small agency to something major, and that is really making a difference in the Atlanta community. I love hearing Larry talk about what it was like at the beginning, because it's so special, and you can just see it in his eyes, the way that the stories of his friends and family members was just touched so much during those early days of the AIDS crisis. Any community-based organization is only as good as the people it serves, for they are the embodiment of its missions and its values. So to hear more about that part, I spoke with someone who has seen a different perspective of Positive Impact Health Centers, from what it's like to be a client and now what it's like to lead a program. I sat down with Brent Jones, who is a manager here at Positive Impact, to talk about his journey with this agency and how impactful it was to the course of his life. Truly a remarkable story. So tell me, what is it that you do here at Positive Impact Health Centers? How long have you been here? What work do you do to support this community?
My name is Brent, and I am recently appointed the program manager for Impact, which is our intensive outpatient program in the Addiction Services Department. I've been here for about 2.5 years as a staff member. but I've been acquainted with Positive Impact for about 5 years.
So that's really interesting that you mentioned Impact and our intensive outpatient addiction services program, because I spoke with Larry and Joey, and they were telling me about how important wraparound services like addiction services is to the HIV community, and why an organization like Positive Impact Health Centers needs that. So if you could tell me a bit why it is a priority for our organization to have a program like Impact. I think of it in the same way as how we have our housing services, nutrition services, dental centers. Why is that important when we are here to serve the HIV community?
In my experience, I think the Impact program is critical to the work that we do. 4.5 years ago, I was a broken person, and I came to Positive Impact Health Centers back when Positive Impact Health Centers was on West Peachtree, and I remember that day vividly. I was a broken person. I had a serious addiction to crystal meth and needed help. I had lost my job. My HIV was out of control. I was depressed, and for me in my situation, the more depressed I got, the more drugs I used, and the more drugs I used, the more careless I was. The more careless I was, the less I cared about taking my meds. And that doesn't bode well for ending the epidemic or stopping the spread of HIV. So in addiction services, the Impact program helps people get sober. When you get sober, you change your life, and the recovery journey is something that I'm really passionate for. I've really realized how important it is by seeing people in our program come to life and get healthy in mind, body, and spirit.
So when you see our clients getting healthy, getting a full life, what does that do for you as somebody who now sees the other side? Because you're now a program manager, so
Right.
you help steer and see the vision for this program, but you can empathize with the clients that we serve because of the journeys that they're on. What does that mean to you?
Right. Yeah, I started as my relationship with Positive Impact Health Center started as a client, and I did the Impact program, so I can relate with the client when we meet for an intake or when they come into the door the first time. I see myself, and I can share my story, and that helps me make a connection with that person and be able to share with that person who's coming into care and show them that it's possible to live a life free of addiction and to live a life healthy. And for me, in my personal journey, it's what I'm passionate about.
That's what it's all about. What has been your proudest moment doing this work?
My proudest moment occurs whenever we have our annual recognition ceremony. We have our clients who I see the first day in the intake process. They come in just like I was, broken, depressed, fearful, stigma. And the day that they complete the program, I see a whole new person that's been transformed, and a person that is employable, that is maybe acquired their own car, they have their own transportation, they have their own apartment, their life has been restored. And when I see that, and when I see someone make progress in recovery, it makes me very proud, because this is what I'm passionate about doing.
Positive Impact Health Center has been around for the next 30 years. What goals do you have for the program, personally, professionally, that you would like to see?
Well, I think in 30 years, we may see a completely different way of serving our clients. Serving people who are HIV positive and living longer will require, in my opinion, more senior assisted living. I'm thinking of senior living centers that can handle people who are aging with HIV, but also have maybe a drag performance or some, gay bingo. The senior life is going to be new for our community, because, we are experiencing some exciting times, some modern advances, and people are living longer. And as they live longer and healthier with HIV, that maintenance is important, but how we live and how we socialize is going to be important. And for me, I'm kind of looking forward to that.
Yeah, it's amazing. You kind of touched on almost, I thought you were going to say it, a life worth loving. Because that truly is what it is. It's what matters to those people and giving them a life worth loving, because we provided the tools. People can live now a long, healthy, full life. And now it's about, what do you do with that life? It's incredible. Any final thoughts, Brent?
Yeah, for me, a life worth loving, I love that about this agency, because that is transforming lives. And for me, a life worth loving means being free of the stigma that we used to carry with HIV, being free from the fear of what my next medical report is going to say, being free of the suffering from addiction, being free from anxiety and depression. That's what a life worth loving for me looks like. And for me, I love where I work. I love the people I work with. I love the clients I get to serve, and I am quite blessed to be here. So for me, I'm living the life worth loving that I dreamed about 4.5 years ago.
Wow. Hearing how Brent just described his journey and how broken he was when he first came here, and to see the whole person in front of me truly brought it home to me. It made the work make sense. And it is why we do what we do every single day, so that we can have many, many more Brents who takes their story of growth and transformation and is able to change the lives of so many people. Did you know that today, according to the CDC, young Black and gay men account for 51% of all new HIV diagnoses in their age group and 21% of infections overall, vastly outstripping their proportion to society? The people that HIV affects has changed, and so Positive Impact Health Centers must change with that new reality. So I spoke with 4 people who are leading that change. I first spoke with Jamal Jones and Justin Smith. When I think about Jamal, I think about myself. You know, we grew up in an era where PrEP has always been a reality, HIV treatment has always been available, and so the epidemic of the 80s and 90s is just not the same to us. And so I wanted to get insight to see how that fact affects the work that he does every day. So Justin, tell me about the moment when HIV became a major factor in your life. What was that like?
So I'm Justin Smith. I use he, him pronouns, and I am the director of the campaign to end AIDS here at Positive Impact Health Centers. And I've been with the agency now for just over 2 years. I just had my 2-year anniversary about 3 weeks ago. So really excited to be here. So I first became aware of HIV when I was about 10 years old. That was the time that I learned that one of my favorite uncles, my Uncle Bobby, my grandmother's younger brother, had died of AIDS. And we didn't really talk about it as a family because of the stigma that was associated with why Uncle Bobby died. But he's the first person that I can remember in my life that died from complications related to AIDS. And he is the inspiration that got me into the HIV prevention field in the first place. And so the work that I do is really dedicated in his memory.
So Jamal, tell me about your journey here at Positive Impact Health Centers. How long have you been here?
So I've been here for around 7 months. My name is Jamal Jones. I am a prevention specialist and HIV navigator, linkage to care coordinator. It's been an amazing journey so far. I really love the work that I do.
Tell me about the moment that HIV became a major factor in your life.
So, I guess I can start a little about my upbringing. From Memphis, Tennessee, and I really never heard really big conversations or open discussions or dialogue about STIs or HIV at all growing up. And it wasn't until around my first HIV test that HIV really made like a difference in my life. I had a very random and sporadic moment around being the age of 18, I Googled a lot of like facts about HIV, and before I took my test, I was like completely in shambles. I remember that feeling, and after the test, I just made a promise to myself that I never wanted anyone to like feel that way. Regardless of diagnosis, I never wanted that feeling to be replicated, especially with young people. So that led me into my internship in undergrad, which I was prevention specialist, but it was community based, and we worked really close to urban populations, and changed my life.
Along that vein, in this work, we hear a lot about stigma. It's stigma, fear, isolation, shame, all of that wrapped in is unfortunately associated with HIV sometimes. So in the 80s and the 90s, when people were checking into the hospital, the main concern was triage and survival. Because people would come in and they would never check out because they were living with AIDS and they would die pretty quickly. So how has stigma affected the way you do your work? What is stigma, and how does it drive the assignment that you work towards every single day?
So, stigma, in a nutshell, is negative attitudes or belief about people who have HIV. That's kind of the most simplest way that I could put it. And it results in discrimination and even violence against people living with HIV. It really is kind of the force that animates a lot of the negativity that we see that impacts people living with HIV. And in many ways, it's actually potentially the most difficult part of living with HIV because, as you said, we have so many medications and treatment options for people that can help people live long, healthy, normal lives. However, just because I have medication I can give you, that doesn't let me change the way that your family might treat you when you come home and say, hey mom, I have HIV. That work is much harder. If I could just give everybody a pill and make them treat everyone living with HIV with dignity, I would do that. But we know that that's not possible. So that's actually the hardest part of this work is how do you change the hearts and minds of not just, the person that sits before you in your counseling session, but really how do you change the perspective of a community? Mm-hmm. And we see that these attitudes haven't changed all that much since the 80s and 90s, despite the many advancements that we've made in our biomedical kind of strategies in terms of how we address HIV. But the stigma persists, and the stigma is actually what is the barrier to actually ending the HIV epidemic that we are trying to do.
That is remarkable. It sounds like the theme of our conversation is building bridges. We're building bridges every day. Any final thoughts? Anything you guys want to add?
I guess what I would say is that I just want to affirm that I think it will be possible for us to end the HIV epidemic. And the reason I believe that so strongly is because I see the dedication and the passion of the people that work in this agency. And I think that we are really an important part of that overall work. And so I know that there are many other agencies like ours across the country that are doing this work. And so I know that, we're dedicated, we're passionate, but we know that there are other people that have that same drive and passion. And so it's exciting to just be part of this overall movement that's really working to tackle this really important health concern. And it's really an issue of justice, right? And I think that it feels really satisfying to be a part of something that is going to change the world.
That's amazing.
My final remark would be that, of course, HIV needs to be looked at different. HIV stigma needs to be looked at different. I think we have a lot of great and advancing approaches, and I'm excited to see the end of the epidemic, but I'm also excited to work towards it. And not only amplifying voices, but also encouraging the people who I work with and that I belong next to community, right? To just keep going. And that, even if it seems far away, it's closer than you think.
Thank you so much.
Thank you.
Thank you.
Stigma. It's such a sad reality that we must confront every day. But I am so happy to know that we have people that are doing it, that are trying to confront this reality. I wanted to not only hear just how PIAC is confronting stigma and tackling that, but I wanted to hear how PIAC is addressing representation. Because as Brent said, as Larry and Joey said, and as Jamal and Justin said, we must look like the community that we serve. And I believe this agency is doing that. So I next spoke with Alphonso Mills and Queen Hatcher Johnson, who both in their roles at the agency are making sure that we are representing our community, because through their own personal stories and their professional stories, they are making sure that we are a big tent that invites everyone in, because everyone deserves a life worth loving. Take a look.
All right, well, my name is Alphonso Mills. I have dual roles at the agency. So half of the time I'm a community health worker. What that means is I assist people that are living with HIV, pretty much tackle down the barriers that are stopping them from being virally suppressed. So whether that's homelessness, whether that's substance use, whether that's just somebody helping them take their medication every day, giving them a little reminder. So that's half of what I do. And then the other half, I'm a study enrollment coordinator for the Black Women's Project that we have at the agency. It's a national project through HRSA, where they recognize that Black women living with HIV have specific needs and need specific resources. So at the agency, we're trying to figure out how to do that, how to better serve our Black women, cis and transgender. So what they do, they sit down with me, I do their intake, which just kind of looks at their life, sees what's going on with them right now, ask them questions about their housing, their employment, how do they cope, how do they deal with stigma and discrimination. And what we do is we do that, and every 6 months they sit down with me again just to kind of see what's changed, what's different, what's working, what's not working. And our goal is to eventually have like a women's clinic and be able to have a trans department and figure out what that looks like. And the best way to do that is by asking. So super excited to be a part of that as well.
I am Queen Hatcher-Johnson. I'm the Gender Inclusive Program Manager. I've been with the agency 4 years going into my 5th year. My primary role is to make sure that the staff is gender inclusive, using gender inclusive language, removing the stigmatizing gender exclusive language that we've used prior.
So when I spoke with Larry and Joey, they talked to me about how representation is extremely important to them and is a priority for the agency, especially from a leadership perspective. And in that same vein, it's been 40 years since the first AIDS patients walked into hospitals. Today, the epidemic is disproportionately affecting a completely different subgroup. Back then, it was white, gay men, and today it is people of color between the ages of 13 and 29, specifically Black and brown gay men and Black and brown trans women. How does that fact affect the work that you guys do specifically, and does that motivate you in any way because of your own personal identities?
Great question, Will. So visibility, representation absolutely matters, especially when it comes to doing HIV research. So I found out that I was living with HIV September 15, 2012. And my journey through that was tumultuous. I was depressed and went through that whole stage. But eventually, I made the decision to turn my life around, to say, you know, I care about myself. I'm going to do what I have to do to live. And I recognize that there are so many people that are just waiting for somebody to show them that that's possible. So in HIV research, the first project that I was working on was just specifically focused on housing and employment for people living with HIV. And as you said, Black or brown gay men really are one of the most highly impacted, along with our trans sisters. So I was able to use my experience to, one, connect with people just on a human level, to say, hey, we have this amazing project that's here that's meant to improve your life. Not to tell you what to do, not to try any new crazy drugs on you, but just to help make your life better so that we can do that for more people after you. So I think it is so important that we use the community to bring community in. Because it's one thing to hear from a case manager, yes, it's important for you to take your meds every day and come to your provider appointment. It's another thing when somebody else says, hey, I know what it's like to have to look at that pill bottle every day. And you're not in this by yourself. That goes a long way, and that really creates an atmosphere of comfort. It creates a place where you feel like you can be yourself, that you're seen, that people don't just want your viral load to decrease, but they want your life to actually improve holistically.
What gives you the most hope for the next 30 years or the next 40 years?
The fact that young people are bold. People are starting to feel so much more comfortable being who they are, expressing who they are, and owning their truths. The fact that HIV no longer has a chokehold as strong as it did before, and I think that's because of the work of previous advocacy workers and people that have been open about their status. It's opened this lane of, oh, okay, well, I can live with HIV and be an actor. I can be living with HIV and be a doctor. I can do all the things that I wanted to do before, and that just be okay. And seeing people do that, it gives a sense of relief to the person that may be living in that rural part of Georgia that doesn't know anybody else that's living with HIV yet. But seeing somebody on TV or encountering somebody that was open about their status helps. So that helps me feel good to know that the generation that's coming after us is embracing all of their truth, but also doing what they got to do to protect themselves. It's about, putting the whole story out there. If we just talk about people living with HIV, then the people that are not living with HIV aren't going to know what to do to protect themselves. So it takes all of us, and it takes boldness, it takes truth, it takes vulnerability and strength.
I love that you said I can live with HIV and still be a doctor and a lawyer. And you know what came to my mind is back when the conversation was, I can live with HIV and still be a mother.
Yep.
I can live with HIV and still be a father.
Yes. Well,
Look how far we have come. It's incredible. Queen, what gives you hope?
What gives me hope is to piggyback on what Alphonso said about the boldness of the youth. I love the boldness of the youth, and no is not an answer, and identity is not a barrier. They're changing the language, they're changing the direction, the trajectory, they're changing employment. I do, and as Alphonso said, and I'm glad that you said it, that it's all on the backs of people who came before. Somebody started this, and the good thing is the baton is not on the floor. Mm-hmm. It is being passed from one generation to the next, and it's getting stronger and stronger, and we're getting faster and faster. And I do believe that if we can, here in Georgia, have Medicare expanded, I do believe that we could get on the forefront of ending this epidemic. So my final thoughts are, how I got to be liberated within myself is I recognize and realize that I am matter, so therefore I matter. So therefore I matter. And as Alphonso stated about, so when you think of trans people on both spectrum, trans masculine and trans feminine, you have to acknowledge that there's a lot of stigma, there's a lot of barriers, there's a lot of discrimination, there's so many different layers, and it gets to be heavy, And until we start empowering humans and get back to humanity, just seeing people as human beings, it sounds so difficult. It's simple. I'll go back to, I learned to know that I am matter. So I matter. When we start with the I, then we can incorporate all of the rest of everyone else matters. But you have to start with you before you have to be the most important vessel before you can incorporate other people.
Thank you guys so much.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. And thank you and you and you. And that's a wrap for the day, everybody. Congratulations. We are matter, and therefore we matter. That's really it. Everyone that comes through the doors of Positive Impact Health Centers matter. As you have seen, The work that our staff is doing every single day is making sure that every single person understands that their life is worth loving the way they want it to. On this World AIDS Day 2021, I remember those whose shoulders I stand upon, as well as those who I walk beside in this fight. The work that we do every single day is pivotal, and it is life-changing and transformative. This year, we mark 30 years of this agency and 40 years since the first HIV diagnosis. Each person that I spoke with plays such an important role in making sure that we are ending the HIV/AIDS epidemic today. This World AIDS Day, let us not only focus on the loss and the stigma, but let's focus on the hope and the progress and the 40 years that is to come. Thank you to everyone that sat down with me. Thank you for your openness, and thank you for your vulnerability. And more importantly, thank you for the work that you do every single day. For I know that there are stories and lives that you have changed in the here and now that we may never know about, but it does not make it any less important. The work that this agency does in this fight is crucial, it is essential, it is transformative. So, here's to the next 40 years. Onward.